I came here originally with my daughter, Courtney, who Dr. Rahman treated for several years, and she had wonderful results. But truly, I did not come here for any kind of treatment. I came here when she came and had her final veneers put on. I had been diagnosed with trigeminal neuropathy now it's been about 14 years, and was on a pretty strong regimen of Lyrica. And it was just something that I just learned to live with. I had visited a surgeon in Houston, Texas, potentially to have surgery, and I was not a candidate. So I just kind of accepted the fact that I would just be on medication for the rest of my life. The Lyrica was difficult to function every day. Things are fuzzy, things are not clear, and you just kind of walk around in a fog. So I just accepted that that's how it was going to be. So I came with my daughter, Courtney, and so when I came, I hate the dentist. I hate going. I usually don't even sleep before I go to the dentist. And so I came with her just for her visit that week. And Dr. Rahman came and introduced himself to me, and he told me that he knew what my troubles were via Courtney, because just with the physical and history that he did on her. And he said, "I think I can help you." Well, that really put me in a tailspin that week. I didn't sleep because I had accepted the fact that I was not going to get any better, and so I was really upset because it was a hope that I had always had that I would get better, but there was no one to help me. So finally, on that Thursday, I had told Amy, his concierge receptionist, that I would make an appointment, and she said, "Oh, absolutely not. We're going to evaluate you now." So they did that very week, and so with all the testing and measurements and everything, he did make an orthotic for my lower jaw, and it was probably within the first couple of weeks of wearing it, I noticed that my symptoms had really diminished. I initially came in with back pain, and that has probably improved about 75%. I've been able to work, do clean toilets, vacuum, that kind of thing, just everyday normal things, and I've noticed that it just hasn't put me down. So it was just miserable. I mean, it would affect the way I would speak. I would have to tell people I'm not slurring because I'm drinking. I was really in pain. I live with a level 4. It can get up to around a level 8. I'm never pain-free. And it would also make my ear canal hurt. I was just miserable. And so as I wore the orthotic, things started improving. And I contemplated, it was like, okay, well, I will try and cut back on the Lyrica. Well, cutting back on the Lyrica did take about a year to be able to safely come off of it. As the months went by, the symptoms grew less and less. Currently, I'm not taking any Lyrica, and I'm not in any pain. I do not have the burning of the tongue, the aching of the ear canal, or the root of the tooth that bothered me so terribly in the past. It's just amazing. I would have never dreamt that I would have had such a great outcome. Phase 2, we decided to do a full mouth restoration with the DNA appliance, is that right? And so he was opening the palate to help with the sleep apnea. as I wore that appliance, I did notice that I would have to call the sleep apnea doctor to turn the volume of the air down, because it was just too much. So I was very surprised at the transition of the mouth, how the lower teeth basically followed the upper teeth. I was very confused about how he was going to achieve the results, but it was very interesting that the lower teeth followed the uppers. So now that we're finished, I would definitely do it again. It was definitely worth it. It was somewhat scary because I chose to not ask a lot of questions because it was really over my pay grade. I just felt comfortable I put my life in his hands, and he did a beautiful job. And the biggest thing is I'm out of pain. So I don't know that you can put a price tag on that.